Okay. How are we doing? Right. Are we there? I think we're there. I can't see because I'm on my iPad, not on a laptop now, because of problems with my Wi-Fi. I can't see whether people are joining, but I'm assuming, Anne, that we have an audience. And I want to welcome the audience and the people, say thank you for joining us. And thank you, Anne Longfield, for agreeing to do this conversation with me this afternoon. I'm really looking forward to it. Anne, of course, recently stood down as Children's Commissioner and spent a very distinguished career looking at caring for the rights of children and looking after the well-being of children. And I want to start with that, Anne. I want to talk about a little bit about your early career, because you started off in the voluntary sector and then of course moved into the, well, apart from a little blip into, you know, the Cabinet Office, a blip there, which we'll come to separately. But moving from the voluntary sector really into the statutory sector, was that very different, or how did you find that?
Yeah, in some ways. I mean, thanks so much for inviting me. Really pleased to be here. And obviously I've held in esteem for a long time the work that you've been doing at the organisation, which is so important. So yeah, most of my working life has been in the voluntary sector, working in charities from the early days, working locally in small local charities, to then working for a national charity, which was tiny when I grew, and which when I joined, and which grew over time. The beauty, I always think, of working in the charity sector is that actually you can get quite a lot done, and you can do stuff at speed. And, you know, for those that kind of, you know, are quite entrepreneurial in their thinking, you can actually test things out and get on with them at, you know, at pace. And you look into the statutory sector and you think, well, you know, they don't have to fundraise, you know, they're in government or they're part of government. So, you know, they don't have to always be knocking at the door. But then, of course, what you realize over time is that if there are you know, it's kind of swings and roundabouts. If you're in the statutory sector, of course, you're a bit nearer, but that prevents you being quite as close to real people and families and children. But also you can't make things happen as such. I mean, I like to think the last 6 years when I've been Children's Commissioner, I've been kind of outside government enough to be able to get on with what I wanted to do at my own pace. But certainly at various points when I've looked in at government and thought, you know, should I really try and be part of that? For me, it's always been a mixed blessing. I like being able to do stuff, and I like having that independence too.
I know exactly what you mean. I'm the bane of my staff's lives, and I come in and say, I've got an idea.
Good ideas.
Yeah, and see the room empty. Your blip in the Cabinet Office, you must have worked with Estelle Morris when she was Education Secretary, and Tony Blair when he was Prime Minister. So that was being at the heart of policy making. Was that about children, and was there a sort of significant change that in your mind?
It was, and at that point, this was the early 2000s, and you know, there were lots of reviews going on about what was needed, reviews around children at risk, reviews around childcare and the like. You know, they were coming thick and fast at various points. And there was an early project started in the late 90s between health and education that attempted to join things up. Sound familiar?
Yeah.
And that, of course, was Sure Start. And it started quite small with 50 or so projects, very local, quite high spend on individual projects. And the ambition was really to learn from the initial pilots and then look at how that could be rolled out across the country. So I was seconded into the Cabinet Office at that time, into the Strat Unit, the Prime Minister's Strat Unit, which was, full of people with blue sky thinking, if you like. I was told that I was the reality check, which, was the person saying, yeah, that won't work. Or, really, I think we need this. This is what people really need. And worked in there for a year and was part of the review team looking at where Sure Start went as a next phase, which ultimately was to look at rolling out 3,000 odd children's centres. So I know more about the detail of some of those numbers than anyone probably ever should. They're stuck in my mind. There was 184 of these and there was 356 of these. But, it was at a point where there was a desire to bring together the good work of health and the good work of education, but really have something very local, which was shaped by the local community. And the big mantra was, of course, within pram pushing distance of where people lived. And I went back out of that, back to charity. I was really pleased to do so, to get on with it, but actually went on to run some of those children's centres over coming years.
I'm a great fan of Sure Start. And of course, there were decades of success with the same sort of model which Lyndon B. Johnson set up in America, and they were based on that, with years of success there. That's and right. It really changed people's lives. I think Sure Start did a fantastic thing for children here. You were appointed the Children's Commissioner in 2015, and that was to promote and protect the rights of children. Now that's an interesting thing, because it's not. I mean, it was also to promote and protect the well-being and welfare of children, but it's very much a rights-based organisation. As I see it, is that right? Have I got that right, or is it?
It is. No, it is. It's very much part of the United Nations Convention on Children's Rights. There's a children's commissioner in most European countries and further than that as well. And they all work in on a very similar kind of agenda, which is around promoting children's rights and protecting their rights in their various jurisdictions. So there is a children's commissioner in Scotland, Wales, Northern Ireland, Ireland, now Jersey, just within our near shores. So it's very much around protecting children within the system that doesn't always protect them. The system doesn't set out to do them down, but actually children fall through that system. And if you look at children who are, highly vulnerable and don't have people to stick up for them, you might think children who have come from Calais, or children who are in care, or indeed in prison. It's easy for that system to overtake their lives and for them to not have that sense that they can have any say about their situation or about decisions that are going on about their lives. So importantly, you're there to not necessarily answer questions or take on cases for individual children, although in some countries that's what happens. In this country, you can take on cases for those individuals in those situations away from home. But other than that, it's seeing where the trends are, seeing where the strategic weaknesses are, and identifying those as well.
And I think that's really interesting, because you, again, sort of going back to the key players that you've worked with. I mean, as Children's Commissioner, I think you've worked with Nicky Morgan, Justine Greening, Damien Hines, and Gavin Williamson. That's one a year practically.
Yeah, four in 6 years. There were 4 governments as well.
Yeah, which is a big change, and not necessarily all familiar with the concept of children's rights. I'm putting that, gently.
Well, I wouldn't have said I necessarily was working with them as one of my primary stakeholders. It's an independent role. It's answerable to Parliament, actually, and the kids ultimately, but the kind of umbilical cord to government goes through the DFE. So that's where you get your administration through there. But it's much wider than that, of course, because kids don't live their lives in pigeonholes. You're looking at every aspect of of children's lives, from their safety and protection, but also their health, their well-being, their ability to have places to play, you know, every aspect of their life, which takes you much wider. But certainly in terms of the Department for Education, yes, there've been 4 secretaries of state during that period, and there've been, I suppose, different appetites around the kind of aspects of children's lives that I was particularly keen on showing, which is around vulnerable children, but also that potential to help children early to prevent crisis developing. Of course, you know, no politician would say that they didn't want the best for children, but quite how far they're going to put it up their agenda is a different matter. But I think whatever they started out wanting to do, the fact that you've had 4 people in that role over a 6-year period means, you know, none of them essentially could get around to doing very much about any of it.
Well, maybe it was a good thing. Maybe they kept out of it, because, you know, it's always helpful when politicians don't interfere, I find. Yeah, there was, just before you took up post in 2014, there was a major change in the legislation, which placed greater emphasis on looking after children who were in care, refugees, and youth justice, which of course is the Howard League's particular concern. That's a wide range of specific responsibilities that were added to your panoply of responsibilities. Is that, I will come on and talk more specifically about children in the youth justice system, but I just wonder whether that's doable. Is it too much, or is it not enough?
Well, I mean, I guess you could always do more, and it was a relatively small team and it was a relatively small budget. But I mean, certainly
too small.
Well, yeah, because, you know, I think the original ambition from Lord Laming's report was a much grander scale of organisations, regional offices and the like. Now, you know, it might not be the need for that anymore. We might have moved on from that phase, if you like, but certainly with greater resources, you can do much more. But it was a strengthening of the role, and it introduced the ability to protect children's rights for individuals. So that's where the casework came in. So if there are individuals who are being moved around with, you know, against their wishes, or are being put in inappropriate accommodation, or aren't getting access to a school that they need, then actually for those individuals that are living away from home, you can intervene for those. So that's a really important role. And, you know, it's so important, but also rewarding when you see those kids. You ask the local authority to look again, which is, you know, how you do it. And most of them come back within a couple of days and say they have, and actually they've come up with a different solution. But that's quite how far, you know, children can just disappear from view in a system if they don't have people there to advocate on their behalf.
That's interesting. I mean, I said I wanted to talk about children in the justice system, which is obviously our concern. And you seem to have really developed more recently a particular and special interest and concern for children in the justice system widely. Was there a particular event or a particular case, or is it just a logical development?
I think you're right, sense it. And I think it's also for kids that are in other kinds of secure provision as well. So those that are in mental health secure hospitals. And I guess for me, with both of those, you kind of wonder as an outsider. I didn't know, you know, I was no expert in secure accommodation or, you know, the children who were placed in them before I came into the role. But, you know, you wonder from a distance quite how those events get to the point where children are sectioned or are in custody or placed in secure, whatever that is. Yeah. And of course, when you see on a very regular basis those children, because, you know, part of what I did over this period of time was to visit on a regular basis, you realize how, you know, there's pretty much a blueprint that happens there. And I suppose there's one point where, you know, there's not that many, too many, of course, girls that are in prison. Yeah. And I think at the time there's about 24. So I decided to go talk to those girls, and actually had quite in-depth discussion and interviews with about half of them. After about 2 or 3, it was so consistent, the story, time after time after time after time. It was children who'd been born and there'd been high levels of addiction, parental addiction, or domestic violence, or severe mental health conditions, usually a bit of all of those, or a lot of all of those. Children who were felt very unstable during the first few years. There would be a whole range of instances that were probably, around loss and conflict and the like. Stark frequency of child sexual abuse. When a girl got to 6, 7, or 8, there would usually at that point something dreadful would be happening. They'd be with their own parents. They would end up living with grandparents. They'd be missing. They would then go to school. They would then be excluded, and on it went. And just the stark nature of that and the consistency. And then if you look again at children who are in often insecure mental health, of course, at that point they needed a lot of help and high level treatment. But actually, if they'd had help earlier, they wouldn't have actually, many of them, fallen into that crisis. And again, if you ask those kids, especially in custody, how did it come to this? They will be able to tell you at each point in their lives where things got worse. When a relative died, a much loved relative, when they were chucked out of their flat, when their mum went into hospital, they could tell you at each point when things got worse, but each of those points as well, where there could have been interventions that could have helped prevent that crisis coming down the tracks. And I guess for me, that was something which, not only could happen, but should happen. So I have, remained very, very committed to that, and actually looking at what I'll be doing from here, certainly around this group of children with complex needs. Also, I found that, too often people were saying these two kids are too difficult to help. You can't help kids over 15. It's too late. You've got to admit some kids, just can't be helped. And I just don't accept any of those at all. So I think it's too easy to give up on these kids and their own, they're not complicated kids, actually. They're kids first and foremost, and they want the same as all other kids. They want hope. They want trusted relationships. They want people to get behind them, and occasionally they need help, and usually they haven't had it.
I think that's really interesting. When I also have gone through a lot of secretaries of state, and one, I think 4 or 5 ago, Michael Gove it was, who had a very strong vision of redemption, that no one is beyond hope. And I think that's incredibly important, particularly with young people, but with anybody, actually. There's the concept of redemption.
Well, I found that, I find that people wrap kind of labels around kids, basically, in these situations. And you've got a risk-averse system generally.
Yes.
And some of the times when I've visited kids that have been in secure mental health institutions, there will be 3 adults watching a child 24/7 to make sure they don't try to take their own life. But actually, you've got a girl in what looks like a cell with a mattress on the floor and a loo next to them. That's described on a piece of paper as a suite of rooms with, a private entrance, a lobby entrance and staff on hand at any point. And that's about managing risk, if you like, rather than actually helping children to recover. And for me, that is the wrong emphasis completely. And the people, I always think you can always find a way to get a relation, to engage with kids. There's always some way you can do it. And it's usually about being able to be trusted and kids feeling that you're on their side. And at that point, you can really start to make things very different.
I absolutely agree with you. It still shocks me, the structural unkindness, the way that children are treated is just extraordinary. Can you remember?
And I often say, actually, with that, because kindness is such an important word with this, I often say to whoever the child is, are they kind to you?
Yes. Yeah.
And usually they do say, not so much in prison, but in those, the other kind of secure situations, they usually say, yes, they are. And, that's, you want more than that, but actually that's not, that's important to bank within it. Lots of things might be going on, but they're relatively kind to them. And kindness is just such an important part of feeling that actually it's not a system that you're just part of, but actually you're important within it.
Absolutely. Can you remember the first prison you went to?
Oh,
with children.
Yeah, I think I went to Rainsbrook first. What I remember, because the thing of course, when you visit for the first time, there's lots of things that are surprising to you. The smell, and put a lot on smell, the noise, the clanking of the keys and the clanging of the doors. But also how long every bit of it took, because when I went there, you'd got very much a kind of policing system where you'd got groups of kids that need to get from this room here to this room here to, take part in some kind of education. And they had to literally walk down a pathway with the officers on either side, all in their uniform, to get somewhere. And it always, I know this is very simplistic and naive, and I also understand that some of the kids have done very bad things, but it always kind of puzzled me. You've got 40 or 50 kids here, actually. How, it's like a couple of classrooms in a secondary school. How can it be this difficult to be able to get to a point where you've got a slightly more normal atmosphere, relationship? I think the other thing that struck me was that you've got a lot of staff in a prison as well. So I remember going to, it was actually Medway, and I think they had something like, it was one of the, difficult periods for them. I think they only had 25 staff or something. And I asked how many staff there was there, and there was 75, there was 75 staff. And I actually said to a minister, I won't name, I went to Medway, do you know how many staff they have? And this person said, oh, go on, tell me, it's going to be awful, isn't it? 8? No, 75. And that changes everything when you see that, because that, if that was a positive resource to actually support, nurture and help kids recover and set them up to be able to flourish afterwards, then that would be a decent amount of staff. But of course, the staff hasn't always been of the kind of profile that would enable that to happen.
You really took up the issue of children being held in solitary confinement in prisons. What triggered that? Why was it? What was it that led you to that? I agree with you. It's appalling.
Yeah, I think it was simply, and I can't even remember which prison it was now, visiting. It was a very, very hot day, and it had been a very, very hot spell. And there was a corridor of kids that were in isolation. And there seems such a kind of lax system around their review. So, you'll know the detail better than me, 48 hours and then 72 hours or something, and then you're in for a week. And there were kids who were in this situation now, in there without any kind of, TV or anything. Some of them had a radio, very little else, and these being the most vulnerable kids. I think that was the other part of this, understanding that these children have so many vulnerabilities, the proportion of children who've been in care and then thinking they ended up in the criminal justice system is just astounding. And then, those with speech and language difficulties, education difficulties, mental health and the like, just being so high. And anyone having to spend their time in solitary to at any point, very, very difficult. But for those kids that are not only have so many vulnerabilities, not only in a very, very difficult situation, but then also having to look at this, exist in this kind of situation. So I remember that very, very clearly. I mean, it felt very much like a kind of Victorian prison at the time. I mean, I have been in different places where they've now thankfully started to look at things in a different way, and you can see at least a glimmer. So my last visit was actually to Wetherby, and their separation unit at least has a more positive aspect to it. But certainly those kids that were spending so much of their time in isolation, I just thought was completely unacceptable.
Yeah, absolutely. Well, you'll know that Howard League has taken a case to the Supreme Court. We're awaiting a judgment on that. But you too have intervened in cases that go to the Supreme Court, which is, it's interesting for a children's commissioner to take that step. I know an intervention is meant to be an impartial expert evidence, but it's but particularly on children deprived of their liberty. Judicial reviews are currently under attack, and themselves could be curtailed. What made you think it was a useful thing for the Children's Commissioner to do? And do you think that intervening in legal cases in judicial reviews was, what was the outcome? Was it useful?
Well, I think the one you're referring to is the children who've been placed in unregulated accommodation, deprived of their liberty in that sense, and in that situation. And this very much related to work that I've been doing and the team have been doing about looking at, the chronic shortage of places for children in residential children's homes, the fact that judges were consistently High Court judges making judgments around having to send children who were in their words, in danger of taking their own life to the kind of accommodation that they didn't think was appropriate, but they kept saying, we have no choice. And sometimes this was, a flat or a hotel room with 3 staff, agency staff. So again, managing a situation rather than looking at kind of the nurturing environment. But at the heart of this, there aren't enough places for the kids who need them. So this was a case which was actually in Wales, where a local authority had been making decisions to place children in such accommodation. And it just highlighted what, the case we've been making. And just sometimes I think that actually when there's a very specific instance of children that, people couldn't see what this means in practice, then you're able to really push this to the fore. So it related very much to the policy work and the practice that we knew was much more widespread. I think you've got to be, you can't overuse those kind of interventions. They have to be part of a wider piece of work. Otherwise, you start to spend your whole time doing that and not make that wider case. Or not being able to continue to be, not be able to put that broader strategic case as well. But I do think it's very important to be able to do that. And some of the, the powers of a role like this, ultimately you can't, as Children's Commissioner, you can't make people do things, but you can use your powers to gather data, you can use your powers to a power of entry to see children and talk to them. And you can use your powers not only to broker, but to really garner a focus. And intervening is one of those cases that I think is a really important part of that kit bag.
Interesting. And one of the powers you have is to publicise based on your research. And the conversations you've had with children, giving them a voice. And the report that you published on the youth justice system just about 3 months ago was very powerful. And you highlighted the pathways into the criminal justice system, and you were very critical of prisons. And there was a very powerful impact from the voice of children themselves, which I think is incredibly important. Now, you called for a new approach to carceral institutions. And I've been nodding along with you for this. This may be something that we disagree about. So in our view, we've tried lots of different iterations of carceral institutions. We've tried prisons and borstalls and secure training centres, and also, you know, there's a whole list of them the last 100 years. And now they've all turned nasty. They've all been failures. So can custody ever really promote the rights and well-being of children? Penal custody, not a health setting, but can a prison ever achieve that for children?
Well, look, my starting point is that I prefer we didn't lock up kids. I think I'm with you on that. And I think there, you know, we have choices of what we do about kids. And obviously for me, I think from what I'm saying, I would prefer we started much earlier. So, you know, when babies are vulnerable, before they start school, you know, at every stage where there's these kind of glaring opportunities that just sink from view. And when you look at, you know, I've talked about the Scandinavian situation where, you know, I think there were 13 kids in prison across 5 countries at one point in 1 year, not that long ago. So again, there are many, many different ways and options you've got here. The other thing I would prefer is if there were pre-secure provision, which didn't mean that you know, it spotted crisis before you got there. It's going to step up, step down. I think that's something I'm really keen to look at. And actually this time last year was just coming back from Norway and Sweden, looking at what they were doing about this and how they were doing this in a much more integrated way. But I'm also a pragmatist and kind of we are where we are. And for that, I'd like both. I'd like my cake and eat it. But for now, I think there must be better ways to actually provide custody for the children that are there. I mean, there's so many ways, you know, and I prefer targets to reduce those numbers. So the kids that are on remand, I think a lot of those could be somewhere else. And even for children with, you know, serious sentences, I hear of good examples where local authorities are providing packages of protection and support around families and keeping them out of prison. But it's clear to me that it's the wrong way around. The intention in guidance is that 80% of kids shouldn't be in remand in prison, and actually 80% are, even though 2/3 don't get sentences. So there's a whole bunch of children there who I would like to see not in there in the first place. And you know, there's good examples that people tell me about in terms of remand fostering and the like that really, you know, need to be part of the whole system. But I think, you know, when you do have children in there and, you know, you can't change everything all at once, if you like, then there are just much better ways. So I think, you know, the secure school, it would be nice not to need it, but actually it has the potential, I think, to try to be very different. I know that Steve Chalk at Oasis would say for him it's a different kind of secure, and it's about feeling secure as much as, you know, being insecure. But I think that you know, in terms of numbers, in terms of different approaches, while we have children who are in this kind of provision, then, you know, there has to be an urgent move to get children into a better place that's much more nurturing and much more therapeutic. I would have liked to have seen 10 of those, you know, small units. I prefer them all to be children's homes, but like, I can't make people do, I can't make people do what they don't want to do. But I think, you know, the children's home model is much that you can gain from.
Well, the local authority run secure children's homes have a much better track record of success than anything else we've ever had, because they're very small.
Oh, that's right.
We have the Howard League is strongly opposing the concept of charities running institutions that are designed to punish children, and what of course the government is doing in this new piece of legislation that everybody's now suddenly so concerned about, this 307-page bill, is they're going to change the law so that a charity can run an institution to punish children, which we just think is wrong. Anyway, that I'm glad we found something.
Yeah, I'm less worried about the charitable status for me is secondary, if you like, because my feeling when I ran a charity was there were lots of things that actually I felt the charity could do better, because it was geared up better to be able to actually deliver some of the services. But I do understand that once you start stretching the kind of public responsibility of the public sector, I could feel that because I felt that I was running it and I would look after that quality. But actually, you then start to open up different avenues for things to go wrong. But I just want to get those numbers right down. Like you, I just want not to go there.
Agree on that. I mean, one of the you've talked a lot about children coming into the system, and many of the children, as you've said, who come into the criminal justice system have come from care. And you will know that the Howard League has been conducting a programme of work on the criminalisation of children in residential care, because what we found is that whilst the police are arresting fewer and fewer children, the problem was very much based in the children's homes. But the problem wasn't the children. The problem was the residential children's homes, which were using the police because the staff were not managed properly, they weren't paid properly, not trained properly, and they were just calling the police. And you've published some reports, interestingly, on private provision in children's homes, which is the majority of children's homes. And there's a lot of money in running a children's home, and in out-of-area placements, which echoed a lot of our concerns. What changes would you like to see in so that children who are usually older, teenagers, older children, and they're in residential care, they are challenging, because all teenagers are, it's part of the job description of being a teenager. So what changes would you like to see to the system, particularly the private sector, which is making a lot of money out of this and doing it badly?
Sure. I mean, what you've had over the last, 10, 15 years is a lot of local authorities haven't replaced their children's homes when they've needed, a refresh. A lot of charities have withdrawn from providing children's homes. A lot were worried about the reputational damage if things went wrong. And the private sector have moved into this market, which, had huge demands. There's been a 26% increase in the number of older teenagers coming into care. Now, a lot of those teenagers coming into care because other people can't protect them. These are kids who are being exploited, criminal exploitation or sexual exploitation. Their parents weren't able to protect them, but then put into residential homes, often way far from home. So about 40% of them being sent out of their area. And what I think you've got then is you've got a kind of market, although I understand some people don't like that term, but a system, if you like, children's homes, whatever you want to call it, and it's really a provider's market. So there's a shortage, 30 kids to every place any day, and if you're providing it, you can roughly charge what you want within it. And then every time something goes wrong, this kind of escalation of additional costs, additional security, additional this, that, and the other. I mean, I would like the market or the system to be really opened up. I would like more charities in there running that provision, and like more local authorities to get back involved. Essentially, these kids, I would prefer they were protected, these kids, actually to be able to stay with their families and stay in their community. They're often being exploited by gangs, often being exploited in other ways. But I think this is one of the areas, we've got a care review going on at the moment, one of those areas that there has to be serious investment, even if it's serious investment to disrupt the market, because there clearly is a lot of money being spent here. It's not unusual at all to have 250,000 being spent a year for looking after some of these children. But I think there needs to be a different profile of organisations doing so. I prefer social enterprises, charities, got much more involved with local authorities, and they need to be small, but there can be units that can cluster together to get that kind of size and scale. Now, the other thing is about the relationship with children in those places, which gets to the point where, you know, the phone call goes to the police or the like, because, you know, if you know that child and you can see things aren't going well, or there's something going down that evening and maybe something is going to kick off, you will know to be able to intervene with that child. You know, be able to have a conversation with them, or, you know, distract them into something else. You'll know how to get over that. If you're an agency staff, you don't know that child, and actually you've not got much training, and actually, you know, you're pretty, you've not got much confidence in that situation. You know, if things go wrong, you'll go for the kind of risk averse approach, which is ring for help. And that doesn't help anyone. We wouldn't do it for our own kids. And, you know, we shouldn't do it for those that are in care.
I haven't got through all of my questions by any means, but I've got a last couple I want to get to you. It's been really interesting. Perhaps we'll have to do it again so I can get through the other
part two.
This is the prickly question. What advice would you give to your successor?
Well, I think the thing that all the Children's Commission, and obviously I'm one in a line, I was the third in this country, all very different. The thing that I think every Children's Commissioner will say to each other is, keep your eyes on the kids, because, you know, you are there for the children and to represent them. And I think that's at the heart of what makes every Children's Commissioner want to do what they're doing. And that's the responsibility you carry, actually. And if there are difficult conversations to have, if there are difficult situations, the fact that you're doing, for me, the fact that you're doing it on behalf of kids that don't have a voice means that it's absolutely essential. So I think whether it's you know, Rachel, my successor, or whether it's anyone else, sometimes in a country where they're just starting up a commissioner for the first time, like Jersey, it's really about being able to understand what the lived experience of kids is, and being able to represent that and do it for people who are making decisions, often in the corridors of power as well.
You've got so much experience and so much expertise. So what lies ahead for you? How are we going to be able to draw on all that expertise as a country, as a nation?
So I'm very committed to this group of children we're talking about, whether they're in whatever secure they're in. There's a group of children there that I think we need to find a better solution for. And part of that is what I've talked about for 20 or 30 years, which is about noticing the kids early that need help and helping them as they go along. But it's also about this kind of high crisis point. And I just think we have to come up with creative solutions here. There are good examples in other countries, and I always like the Scandinavian ones. I know that's very predictable. They're not got it all solved, but they're further along looking at integration than we are here. So I've got a real interest in that. I can't give you the exact form that's going to come out at the moment, but also I'm continuing to be the independent chair of 2 of the NHS boards, which are around improving the quality of inpatient secure health for children, which I've been doing one of those for a year and will continue to do so. So these are the children that I really think, you know, we need to deserve a better solution. And I want to do my bit to help make that happen.
That's fantastic. And I will take away from this, remember the child in front of you and remember the children. They're the most important things. Thank you so much, Anne. It's been really interesting. It's been a real pleasure, and a lot to take away, a lot to think about. And for the people listening, thank you for listening and taking part. We recorded this. It will go up on YouTube or the website or wherever. Do look at the Howard League's website. Do, of course, join the Howard League, because we're an independent charity and we rely on your support. and stay in touch, and we'll stay in touch too, because we, you know, there's a lot of conflicts of interest there. But thank you so much. It's really
continued.
Thank you.
Thank you.
Thank you. I thank everybody. Goodbye.